Okay, so good morning, good afternoon, good evening to you all wherever you are in the world, and welcome back to the Thursday Talks on DME for Peace. I know it's been a while, it's been a long summer, but I'm excited to see some familiar and some very new faces joining us today. Just in case you've forgotten, my name is Jack Farrell. I am the Manager for Partnerships and Strategic Innovation at Search for Common Ground, and I'm going to be your host today. But that's enough about me. So let's talk about why we're here. Today, I'm delighted to be joined by my Search for Common Ground colleagues, Hilda Deman and Sama Abdelrahman, to host a discussion on a story of resilience and fragilities, the impact of COVID-19 on horizontal cohesion in conflict-affected countries. Now, just a note, if you have a question during today's presentation, you can write it in the question or chat function on your GoToWebinar dashboard, and we will address it once we reach the discussion. I'm now going to hand over to today's guests. Hilda and Samah, you are very welcome to the Thursday Talks. Feel free to take it away when you are ready.
Thank you so much, Jack, and thanks for having us. So my name is Hilda, I'm the Global Manager at Search for Common Ground for overall COVID response. My colleague Samah and I will be presenting today some of the main findings from a piece of research that we've been conducting over the past year. So Samah, if you could go to the next slide, please. Just to put a bit into perspective the research that we're talking about. First of all, just to acknowledge that there's a lot of research that has been conducted already since the pandemic broke out about the impact that the pandemic would have on conflict dynamics. And we've seen different hypotheses put forward on that. I think what the research that we're about to present to you today is a bit unique in a way. First of all, because it's purely based on quantitative data, which is something that we're using survey-based data collection for this, which a lot of the other research is more like desk review or qualitative. So the quantitative aspect here is interesting. It's also periodic. It's a piece of research that we repeat about every 3-4 months in our 6 target countries, which really allows us to track trends over time. And then the third element that's quite unique about this is that's multi-country. So you can see on the screen the countries where we conduct this research, and as you'll see, they're quite different countries in terms of context and in terms of conflict dynamics. I want to also just emphasize the objectives of why we're doing these research. Just to put it simple, we're trying to track 2 things at the same time here. First of all, we want to, of course, better understand how the pandemic is impacting pre-existing conflict dynamics in these countries. But we also want to just see how pre-existing divides and conflict dynamics influence people's reaction to the pandemic, to their government's response to it, and including the vaccine rollouts. It's in a way these 2 main dynamics that we're trying to understand: the pandemic's influence on conflict, but also how do conflict divides impact on how people experience the pandemic and their response to it. We are tracking these trends in 6 countries, as I said, and we're doing that through regular country reports. You can find on the below of the screen, you can find the links to where you can find all these country reports. And then what we've been trying to do also since the beginning is track thematic trends. And so we've issued 2 thematic reports so far. Our first one focused on vertical cohesion. So how does the pandemic impact on people's trust in their government and on their satisfaction with the government response? And the second report that we'll be presenting to you today is about horizontal cohesion. So how is the pandemic impacting intergroup relationships in particularly divided countries? And I want to highlight just that the report that we've put out is based on our data from rounds 1 and 2, but the data that we'll be presenting today actually also includes data from round 3, which we've been able to conclude over July and August. So it contains more rich information even than what's in the actual report. And the next report, just to also flag that the next thematic report that should be out somewhere later October is going to look at the gendered impacts of the pandemic. Maybe just to also quickly say, I mean, it's perhaps obvious, but the reason why we do this research is, of course, to understand what's going on, but it's also to adapt our own programming. We have a large multi-country COVID response program funded by the EU. And so the insights that we get through these research is really important for us to be able to adapt our programming, our media productions, etc. And I would say both in a positive and a negative way. And by that I mean, we try to look for what can be potential triggers. So where do we have to intervene because we see potentially the pandemic negatively influencing certain tensions or divides, but also positively in the sense of where are there perhaps untapped potentials for further collaboration or resilience strengthening through the pandemic response. So over to you, Samah, for the presentation of the findings.
Thank you, Hilda, and hi everyone. My name is Samah and I'm working as Data Management Officer for this COVID-19 response. I'll be presenting today to you our findings related to the horizontal cohesion. But first of all, we'll give you a quick overview or description of our horizontal cohesion indicators. Search estimates horizontal cohesion through 3 different indicators, and each one has a proxy question and it's asked separately across each dividing line. We have different dividing line based on the context in each country. So in Kenya, for example, we have people from different counties and people from different political groups. In Nigeria, we have religious dividing line as the main dividing line. In Yemen, we have people from different districts and people from IDPs or host communities. In Palestine, we have people from different regions under different governmental authorities. In Uganda, we have refugees and host communities. And finally, in Tanzania, we have people supporting different political groups. The first indicator, as you can see here, is value and collaboration, and it's measured through the level of agreement with the statement, I can see value in collaborating with someone from another group to respond to a crisis. This indicator actually gives us insights on how collaboration across divides could contribute to pandemic responses, to appropriate pandemic responses. And also, it gives us insights. On groups who or potential risks of groups not valuing collaboration well. The second indicator is about having actual interaction, and here we ask this question if they had any actual interaction in person or remotely with someone from another group on daily, weekly, monthly, or quarterly basis. And we can see that valuing collaboration doesn't always result in more interaction. For example, movement restrictions could limit this interaction, but also interaction could be happening out of necessity. So we try to characterize the nature of this interaction through our third indicator, to what extent our respondents feeling safe when they are interacting with across divides. And of course, reduced level of safety while interaction is happening is a potential risk for horizontal cohesion, and this may be a tension or conflict trigger. Now I'll be presenting to you the main findings of our research. But first of all, it's very important to say that some of our research countries face different waves of COVID-19, including COVID variant. Some other countries were facing tense electoral periods, as in Uganda and Tanzania. All these situations impacted directly the social cohesion, and of course, this is including the horizontal cohesion. As an overall, people in the 6 target countries value collaboration, highly value collaboration, and we see an increase from September, which is the period for the first round of data collection. September last year, I mean, there was an increase from 75% to 80% May this year. The pandemic, the pandemic could be a connecting factor where we saw intergroup solidarity. But still, this is not the case at country level. So comparing the first round to the third round, we see small to larger increases in Kenya, in Nigeria, Uganda, and Tanzania, but still a decrease in Palestine and Yemen. For example, in Yemen, we see a decline comparing the first recorded level in the first round with the level in the most recent round. This decline is driven by the decrease in value and collaboration across districts that could be attributed to the deteriorated security situation. Also, there is a decrease in value and collaboration between IDPs and host community members, and this potentially pointing at higher competition around shared resources caused by the pandemic. For the second indicator, actual interaction, also we see an increase from 66% to 70%, but still at country level, we see different trends, where sometimes applied movement measures or increased needs could contribute to these changes. So we see, comparing the first round to the most recent one, we see increases in Nigeria, Yemen, and Uganda, but still there are decreases in Tanzania, Kenya, and Palestine. For Palestine, still the current level is lower than the first recorded level, but between the last two rounds, we have noticed an increase, which is influenced by the security instability as well as by easing movement measures. It's important to say that in Palestine, interaction between regions is driven mainly by economic activities, and this was directly impacted by COVID-19 due to the COVID-19 prevention measures and movement restrictions. But Palestine always has very low levels of interaction among our 6 target countries, and this is not totally related or as a result of COVID-19. As always, there are physical barriers preventing people from different regions in Palestine to interact with each other. Our third indicator, feeling safe when interacting across divides. If you see here, we started to measure this indicator in the second round, and we see an increase from 75% in beginning this year to 77% in May. For example, in Kenya, we see some governmental actions were applied to address the increased rate of gender-based violence during this pandemic. And one example of those actions, that Ministry of Health issued guidelines that deemed healthcare for gender-based violence survivors as an essential service. And also the government included gender consideration into the pandemic response plan. As you see, looking at gender trends, women highly value collaboration across divides, and in many places, women have been among the first responders to support their communities. For example, they were producing face masks or sometimes troubleshooting some existing challenges resulted from the COVID-19 measures, as for example, water shortage. Also, we see that women still have lower levels of interaction across divides than men. But as an overall, women interaction is increasing since the pandemic. But again, at country level, this is not always the case. And in some countries, women are more likely to feel the effects of the social isolation, creating a situation where social norms and social barriers and gender norms could be, or they are already becoming more entrenched. Finally, for the age groups, I didn't present the rates for age groups, but generally we didn't see significant differences between our 3 age groups. And by the way, we are considering young people from 18 to 34 years old, adults from 35 to 49, and older people, those who are above 50. I mean, we didn't see significant differences in terms of value and collaboration across divide, and this is a very important opportunity for multi-generational collaboration across divides. However, still, in terms of interaction, we see this is lower for older people, and in some countries it's very low compared to the other age groups. And this could be attributed to different factors or different reasons. For example, older people may have less opportunities to interact remotely, as we ask this question if our respondents are having in-person or remote interaction. And also maybe because old people are following more the precautionary measures comparing to other age group or younger age group. Also, old people report lower rates for feeling safe during their intergroup interaction, meaning this group is relatively vulnerable compared to the other age groups. And though the overall horizontal cohesion rates are relatively high in many countries, and even at the overall level of our 6 countries, still it remains fragile, considering the pandemic secondary impact and the security situation. So, for example, when we disaggregated the data and when we looked at micro levels, in many countries, we see that this overall increasing or improving trend is not applicable to other groups, disaggregated group, and this overall indicator hides some vulnerabilities. For example, in Kenya, in Mombasa, it's one of our target community counties. We have noticed that horizontal cohesion rates are very low there compared to the other target counties. In Yemen also, for example, there is a perceived perception that IDPs are always prioritized by humanitarian actors, and therefore we see lower levels of horizontal cohesion related to the host communities. Also, another risk factor that is the security situation. Many respondents in our target countries, particularly in Yemen, Palestine, and Nigeria, they don't see COVID-19 as their top priority, especially when security situation deteriorates. You can see from this graph, violent events, you can see the high historical trends for insecurity situation in those countries. In Nigeria, for example, and though the criminality rate increased since the pandemic in some regions, people still believe that addressing this insecure situation is more important than addressing COVID-19 or COVID-19 responses in general. Another important point we should pay attention in the coming month and the coming years is the increased needs, as the pandemic impacted severely the socio-economic situation and all life aspects in those target countries and in the world in general. Horizontal cohesion remains at risk, considering the competition over the available resources. This graph you see at your right hand, it shows percentage of respondents experience full or partial loss of the main income in their households. We have asked this question also starting from the second round of data collection, and we see this level of losing main income partially or fully is very, very, very high, even if we looked at the lowest percentage, it was 43% in Yemen in the second round, but still this is relatively very high percentage. And already we have noticed in Uganda, for example, we have seen some clashes and tensions over land and other resources between refugees and host community members. Hilda?
Thank you, Sama. Thanks for all these really interesting findings. And again, just hearing you present it just points to the complexity sometimes of what we're dealing with, right? I just want to take 2 more minutes just to present to our audience some of the ways that we're adapting our programming to that. And so first, one of the things that, for those of you who know Search for Common Ground, we of course do a lot of media productions, and we've done that a lot throughout the pandemic response. And some of the ways that we see that improving access to information can help in improving horizontal cohesion. I just want to highlight 2 examples. In Western Uganda, we saw in our first country research that we actually saw quite high levels of tensions between refugee communities and host communities. And there was a perception that the pandemic response was not being done in a fair and equitable way for both those communities. So we wanted to avoid that our media productions and our own programming would be perceived in that same way. So then we set up, we kind of shifted gear from what we had initially intended to do, which was separate programming for both communities. We actually did joint broadcasts, and we trained journalists from the refugees communities and from the host communities together, who then developed joint broadcasts in the different languages of that region, to, first of all, to disseminate just factual information about the pandemic and what's going on, but mostly also to demonstrate to the different communities how the pandemic is impacting each of their groups in similar ways and what can be some of the joint solutions. And that was, for example, the training, the feedback that we got from people in that training was the first time that we're actually doing this type of training together. So that was just in terms of building trust and open communication channels, that was an achievement in itself. Our Kenya team, and I think we have some of our Kenya colleagues online, so I'll definitely let them speak more if we have a chance. But in Kenya, the team there did a lot of really interesting approaches in terms of strengthening collaboration for the pandemic. And one of the things that they did was interfaith dialogues, where they brought together religious leaders from different faith communities and strengthened them in their role to take a stronger lead in communicating information about the pandemic to their faith community. So those are some of the ways that we are responding. And then I'll just end with a final slide. Sama, if you can move forward to the last slide. Some of the key recommendations that we want to put forward. First of all, the data that we get through tracking these horizontal cohesion indicators can be important early warning signs. For example, as Sama has presented, we've seen overall an increase in horizontal cohesion, but if you actually break it down per country or per different demographic group, we see some key points for vulnerability. So things to watch out for example, are sudden drops in valuing collaboration among certain groups, or for example, sudden drops in feeling safe when interacting with others. Those can be indicators of increased tension, of increased stigma, or of people turning back more to their identity group. So those are flashpoints for violence that we need to look out for. The second point I want to make is there's a lot that's been said, of course, about how to do more conflict-sensitive pandemic response, which we, of course, all underline. But I think we can take it a step further, and we should be looking at how can we actually promote intergroup collaboration through the pandemic response. And I think some of the data that we have actually points to some key opportunities that we can use to strengthen collaboration across devices through the pandemic. Which is something that perhaps we haven't done enough at the local level. So things that we can do is, for example, work together with health actors to map out different actors who have a key role, who can play a key role in the response, but who can also be trusted interlocutors between groups and who can kind of model collaboration through their own behavior. A third recommendation that we want to make is a lot has been said during the whole pandemic about the infodemic, and a lot of organizations, including our own, are focusing on fighting rumors and misinformation online and through media, which is all important. But again, I think we should take it a step further. by also promoting messaging around social cohesion through the pandemic response. And for example, by providing timely, accurate, and equitable information, we could also be adding messaging around promoting trust, promoting unity and social cohesion throughout many of the campaigns that we're seeing. The fourth point, just to underline, and as I said, our next report will focus specifically on the gendered impact of the pandemic, but is about the role of women, which we've seen from the very beginning, especially in our first round. It kind of struck us that women tend to value collaboration more, but they feel less safe and they have less opportunity to interact. So if we're able to actually promote safe ways for women to interact online and offline, and do that in ways that are able that address women's needs and that are able to adapt to what they can and cannot do. It can be also a way to ensure opportunities for women during the pandemic and to better address their needs. And then the final note, just to end on, I want to point out the last graph that Sama presented around the statistics of people who said they lost their main source of income during the pandemic, which we see really high percentages. Everywhere it's 40% and above, in some places like Nigeria, up to 60% of people reporting loss of income, which is really high. It's much higher than what we've seen, for example, with the Ebola epidemic, etc., just because the lockdowns are so heavy in many countries. So I think we need to prepare as a peace building community for the long-term secondary effects of the pandemic. What does that mean for competition among groups? Especially because many of the countries where we're talking about, they don't yet have access to the vaccine. They have very unequal access to the vaccine even inside their countries. So we're going to continue seeing in the medium term quite high levels. The economic impacts are not to be underestimated, and so the competition is going to continue increasing. And I think here it's often been said, we've heard a lot about vaccine equity, but I think this principle of equity in the response and governments being really transparent of the capacities that they have, just not to exacerbate intra-group tensions, is going to be really important for what lies ahead. So I think we'll keep it to that. Sama can just perhaps pull up the, thank you, Sama. So yeah, Jack, thanks again for giving us the opportunity, and we're happy to respond to questions or hear people's feedback and comments.
Great. Well, thank you both, Hilda and Sama, for a great presentation and for all of your work over the past 18 months on these thematic reports, conflict snapshots, and sort of leading searches, COVID-19 response programming. I think your key recommendations are something nearly everybody on this call will be able to resonate with. I know in my own work with DME for Peace and our associated platforms, you know, we've seen the need for greater collaboration and coordination, both at the local, national, and international level. You know, we have these complex shared problems. COVID-19 is one of those. And those require shared and integrated solutions. That's what we should be pushing forward. And I think COVID-19 and the COVID-19 response really demonstrated how uncoordinated and competitive we are with other sectors, despite, you know, technically working towards the same goal. So I think that's a great point. And then just the last one, which stands out to me, is it's not just enough to combat disinformation. You can't meet fire with fire and expect to end up with water. You need to provide reliable information. You need to influence information ecosystems with reliable actors who are there to provide accurate, reliable, and safe information to people with authentic voices. And, you know, one of the projects we've worked on in the past year is through the Connexus platform. Our Influencers for Change network has really tried to identify digital influencers with authentic voices who are trying to promote positive social change in their communities. So they're not, you know, just fighting disinformation. They're, you know, being spokespeople in their communities to provide access to information that people need. So I think that's something really important that people can take away from this work and from this presentation. To our audience, now is your time to shine, because it's a discussion session. A couple of notes about our format for those of you who are unfamiliar with the Thursday talks. You can submit a question in two ways. The first is through the question or chat function on your GoToWebinar dashboard. The second is to click on the hand icon on your GoToWebinar dashboard. That will raise your hand and allow us to unmute your microphone so that you can ask your question live. When you do submit your question, we ask that you submit your name and affiliation. Just a note, these talks are recorded. We post them on DME for Peace, so those who are not able to join us at this time can go back and listen to the presentation and learn from our very active discussion. So our first question, Hilda and Samah, comes from Victor Balagoon. And Victor writes, do you have any intentions or is there any data or research being done into the need for mandatory vaccination? Some state governments in Nigeria are making the vaccine mandatory for their workers. We're wondering, is there any data behind that?
I can respond to this question. Thanks, Victor, for the question. I don't know if we have any colleagues from Nigeria online, but if we do, please also step in. The research that we do does not specifically ask about people's vaccine intentions, just because there's a lot of research already out there, and also because we're not a public health organization. What we have done with our teams, because of course this question of vaccine and whether or not what we should say about it as an organization has come up a lot, especially because we also do a lot of media programming. And what we've always told our teams is that we're not going to take as an organization a stance on the vaccine, of course, that's not our role. But what we can do is just provide people with reliable information about the vaccine, make sure that people are aware about their government's intent with the vaccine, providing a platform for debunking rumors about the vaccine, because again, that's something that we've seen a lot of rumors about, and just engaging with people in an open and honest conversation, and not just dismissing people's doubts or hesitancy about the vaccine. And I think one thing that we really tried to do, if I can make reference to our first thematic report that we put out earlier in the year that looked at trust in authorities, one thing that we saw as a clear dynamic, and that's perhaps not recognized enough by the public, by the global health sector, is that there's the issue of trust in the vaccine, but there's also an issue of trust in the government. And if you have a population or a group that has very low levels of trust in their governments, they're automatically, or there's high chances that they're going to also reject any type of vaccination effort coming from their government, regardless of whether that vaccine may be beneficial to them. It's just that they have their reasons, and sometimes valid reason, to distrust their own government because of bad experiences in the past. And that's something that we need to take into account. And it's a problem that we saw in Nigeria, but it's even a problem here. I'm based in Brussels, and in Brussels we see very low vaccination rate among young people, and we see that that often goes together with young people's rejection of the government, and not thinking that the government actually has any good intentions for them. So then also rejecting any vaccine-related efforts around that. I'll keep it to that. Perhaps there's other colleagues who want to join.
Samah, I know that you just shared some research with me on this. Would you like to share that with the audience?
Actually, in Kenya, in the third round, Kenya country team, they added some questions related to people trust on COVID-19 vaccine, and only 32% of our respondents trust the vaccine. And the main challenges were for women, especially when vaccine centers are far away from their living area. So this is a challenge for women to access vaccinations.
Great, thank you, Samah. And I know we're joined by colleagues from NGOs around the world. The one I want to call on is Thomas Niaga. And Thomas, you've just written a comment that these findings sound very similar to a study that you conducted in Kenya for International Alert. So Thomas, I'm going to unmute your microphone. So if you want to unmute yourself, I'd love to hear some more about that research you conducted for International Alert, and sort of some of the findings that you discovered there. You are self-muted, Thomas. So if you want to just click on your microphone, we can unmute you. Okay, there is some kind of technical issue as always on a webinar. So what we're going to do is we're actually going to go to a raised hand from Prince Charles Dixon in Nigeria. So Prince Charles, you just need to unmute yourself and you should be ready to have the microphone. Go ahead, Prince Charles. And your microphone is not working. We seem to be having all of the technical issues in the world. Maybe we can fix that. But as we wait for some of these microphones to start working, our next question comes from Dengiefa Angalapu, and Dengiefa is from the Peace to the Streets and Creeks movement in Nigeria. And Dengiefa writes, can you please explain a bit on the methodology of this research, especially the sample size and states selected for the study in Nigeria?
Okay, I'll take this question. Actually, in our research, we are selecting at least 400 respondents per country, and this sample is selected randomly, and still it's a representative sample representing gender and different age groups and some dividing lines. Our surveys were conducted in person or remotely, and this was decided by country teams based on their context and based on their countries. So, for example, in Nigeria, our country team believes that communities in our target zones, they are not very responsive. I mean, they will not be very responsive using the remote data collection. So we decided to conduct surveys in Nigeria in person. In Uganda, for example, we did also in-person data collection due to accessibility issue, and people in our target areas, especially refugees and settlement, they don't have full access to phones. But still in other countries, our country teams, they have like a predefined list of beneficiaries from their previous experience or from their partner networking. So they could implement or conduct those surveys in person, via the phone.
Great, thank you, Sama.
Maybe just to add for, Jack, if I can just to add for Nigeria, because I think the question was also which states did we conduct the research in, so that varies a bit from one round to the other. But for people who want more detail on that, I would really refer to the snapshots themselves. So if you click on that link, either Connexus or on our project website, you can find the country reports. For Nigeria, we actually just published a third one. And so you can find details on which states exactly. It's pretty broad. It's pretty nationwide for Nigeria, actually. So
great, thank you, Hilda. And for those of you joining, if you go into the chat box, there should be a link to the conflict snapshots on Connexus. We've heard a lot about Search's work in Kenya today, and we have a couple of members of Search Kenya online. And I'd love to learn more about the programming that Search did. So Zena, I am going to unmute you. I hope you're ready. If you could unmute yourself, Zena, and just share a bit more about sort of Search's work in response to COVID-19, as well as some of the learning and research and how that affected our programming.
Thank you, Jack, and thank you, Tim. Thank you, Hilda and Sama, for that very good contribution. So basically, for the past 1 year or so, we've been working with the interfaith community because we realized that to fight the war on COVID, we cannot simply do it on our own. We need people who are trusted within the communities, and we also need people that have a following. One of the areas that had a lot of disinformation was from religious institutions such as churches and mosques. So we thought if this is where information that is false is spreading very fast, so we can still use this as an avenue of, spreading information that is verified and information that is factual. So as a part of our early warning team, we had representatives from churches and mosques joining the early warning team and being able to share what they're hearing from churches, from mosques, and from basically just hangouts. And from those particular groups, we were able to design interventions or activities that were centralized around passing on information that is credible and it's verified. They used to to demystify this information on Fridays, especially because this is when Muslims go to the mosque in large numbers. Also on Sundays, that was also a time when majority of the people could actually even go to churches. Part of our community influencers are actually religious leaders and they're trusted in communities. So it was much more easier for them to move into communities and speak to people about how to demystify COVID, while at the same time, you know, encouraging the communities to work with the local authorities because it's a war that cannot be fought in isolation and we need concerted efforts. So those are some of the things that we did here in Kenya. Of course, challenges here and there, but we managed to do a successful program, Jack.
Zina, thank you so much for sharing, and I'm so glad that the microphone worked, because third time, you never know if it's a charm or a curse. So the other people I just want to go to is just to try once more for Prince Charles, because I know you have an interesting perspective on this, Prince Charles, with regards to faith and vaccines in Nigeria. So I'm going to unmute you, Prince Charles. I'm going to try one more time. And if you want to try and unmute yourself. I'll give 5 more seconds, Prince Charles, and then if not, we can move this discussion forward. Okay, so unfortunately, we've had technical issues with people who have some microphone challenges, but I want to sort of use this opportunity to thank everybody for joining today's webinar. And the Thursday talks are only 45 minutes long, so it's not a huge amount of time to get through all the points and get to all the insights, but the fun doesn't have to stop here. I am delighted to announce that this is the world's first webinar to have an official after party. Yep. I know that many of you still have some ideas, insights, and questions that you would like to share with Hilda, Sama, and the wider community. So we have set up a forum on DME for Peace's sister platform, Connexus, to allow you to continue the discussion after today's webinar, and that link is now in your chat box. So if you don't already know, Connexus was the global platform that I referenced earlier. We set it up in response to the coordination and connection challenges that we were seeing in the COVID-19 response. And over the coming months, we're going to be broadening the platform to create more connection opportunities across sectors and shared challenges that include climate change, the peace building, development, and humanitarian nexus, as well as public interest technology. So it's super quick, easy, and free to sign up. You can sign up using your Facebook, Google, or LinkedIn account, or you can fill in the quick sign up form. And that link is also in your chat box right now. So that is the cnxus.org. So please feel free to return to the discussion and share your insights. You can access the conflict snapshots on there. You can connect with practitioners around the world, connect with our influencers. And I'm really excited to see where this discussion goes in the coming days. So thank you again, Hilda and Sama, for a wonderful presentation and discussion. This is a very important topic. There was a lot of data shared, and I know many of us are going to sort of sit back and reflect on this before sort of really offering insights, which is why I'm really grateful to have the discussion forum. A special thank you to everyone in our audience for joining today's webinar and providing fuel for our discussion. I hope to see you on the Thursday Talks again soon, particularly those new faces. This recording will be posted online on the DME for Peace Media Gallery, and it'll also be posted on Connexus later today. So please return to it. Feel free to share it with your colleagues. And like I said, please continue the discussion. We're going to be back in a couple of weeks with the Women and Gender Empowerment Consortium based out of Washington, DC. They're going to be hosting a Thursday talk, and more information on that will be posted on the DME for Peace website in the coming weeks, as well as through all of our traditional communications channels. So take care, and I look forward to seeing you soon.
Thank you again, Jack, for having us, and have a wonderful day, everyone.
Thank you.